Hello, today I have chosen to discuss the transition to shift work, the potential health risks including mental health, and the best ways for graduate nurses to manage these risks. In the article, New Graduate Nurses' Adaptation to Shift Work, Can We Help?, the authors summarise that patients need care 24 hours a day, 365 days a year, and they also need nurses to care for them. This requires nurses to conduct shift work, including night shift, and may also involve nurses being on a rotating shift basis, meaning that their shifts can change from morning to afternoon and night shift depending on the roster system they're on. It can be difficult for a graduate nurse to transition to this lifestyle, coming from being a student to that of a full-time shift worker. The rigours of being a nurse and conducting this shift work can have an adverse effect on the nurse's health, including mental health, as well as impacting the home and social life of a potential nurse. The article Night Shift Work and Its Health Effects on Nurses explains that shift work disrupts the human's natural body clock and in turn affects other aspects of health. Studies have shown that a nurse who works night shift has an increased risk of cancer, diabetes, a compromised immune system, obesity, as well as disrupting relationships with spouses and children. In another article, Impact of Shift Work on the Health and Safety of Nurses and Patients, they discuss that the interruption to a nurse's sleep patterns during that transition to different shifts can alter a nurse's level of alertness and their ability to perform tasks. This in turn can potentially result in an increased risk of accidents and injuries both to staff and patients. It is important for students who are about to commence their graduate year to be aware of the risks associated with shift work, as well as for potential methods to manage their health during this time. It is important for students to get as much, or nurses, to get as much unbroken sleep as possible whilst on night shift. Ways to aid in achieving this include installing blackout blinds, sleeping in cooler conditions, as this helps promote sleep, and avoiding caffeinated drinks such as coffee or energy drinks. According to safework.vic.gov.au, it is also important for nurses to eat light meals at appropriate times. This includes having carbs such as rice, pasta, bread, potato, etc. And appropriate timing to help aid in the reduce of indigestion when trying to sleep. Safe Work also state that it is important for mental health. It is important for a student's mental health to maintain normal social interactions. However, it is vital that these interactions be planned and organised to allow enough sleep for their nurses. Thank you for listening.